We treat people with just about everything. Our youngest patient is about 2 years old, and our oldest patient is 102 years old. I see him about every month. A lot of people come to us who don't even have health issues in the sense of being sick. A lot of them come for wellness purposes, or people who are at a certain age and want to live healthy for the next 40 years or the next 60 years. That's what we like to work with. We help them with their lifestyles to prevent disease. But we also treat disease. We treat people who have osteoporosis, high blood pressure, heart disease. We see people for hormone replacement therapy. We see kids with autism. We see kids with attention deficit disorder. We see all kinds of problems, and there's probably no medical problem that we can't offer some help with. We see folks who have cancer. We help them with their nutrition. We help them with nutritional supplements. We work with rheumatoid arthritis. We work with autoimmune diseases. We work with liver disease and kidney disease. You name it, we pretty much see it. And generally we can find things that will help those people. Well, diagnosis is a very important part of what we do. We don't look at people and fail to come to a conclusion as to what's going on with them. So we want to know if a person has osteoporosis. We want to know if they have heart disease or high blood pressure or high cholesterol. So we test for all those things. A lot of times patients will come in with these tests already done, and we'll review those things. If they need further testing, we'll do them. We also work with a lot of alternative tests, or things that are not usually considered by conventional doctors, things like food allergy testing, or heavy metal testing, or how does the bowel work, or how is the liver detoxifying. We have a list of about 50 different things that we'll pull into play depending on what's going on with the patient. And this helps us to decide what's their metabolism like, how is the body working, and every time we find something that's wrong, we make adjustments to help and fix it. I like to say a little bit about drugs. Drugs are actually overused in our society. There has developed a system that we have where the patient goes into the doctor's office and the doctor hears the complaint or makes a diagnosis, and he heads for the best drug for that problem. So every time the patient goes into the doctor's office with a different problem, he gets a different drug. And after about 5 or 6 visits, now you have a patient who's taken 5 or 6 drugs. And those things work against people. There is no drug on earth that doesn't have side effects. Even the ones that are over the counter have side effects. And we used to think that something like acetaminophen was a totally safe drug, and it isn't. It's well known to cause liver disease, and if you drink alcohol when you're taking it, it will cause more liver disease. So it's important for us in our practice to work to avoid the use of drugs as much as we can. And patients actually come to us usually taking a number of drugs and want to get off as many as they can, or at least reduce the dose. So our purpose is to look at them and find out what we can do. If the person's got high blood pressure, we'll work on modifying their diet, reducing salt, increasing exercise, changing their weight, and eventually, when things are still under control, we get those medications down. And we've had a number of patients who were able to totally get off of antihypertensive medications using lifestyle alone to control blood pressure.